Hello everyone. We are going to be going through the lecture outline called Review of Normal Development through a series of 3 shorter video recordings, but you can just follow along. They'll go in sequence with your lecture outlines, and I've divided those into 3 videos. We're going to start with embryonic development, then we'll go to fetal development, and we'll finish up with postnatal development. So that will cover your review of normal development. So we'll start with the pre-embryonic period. So we're going to actually start back at conception. And the reason we're going through this information is because a lot of the conditions that we see in children in physical therapy are due to changes or problems that occurred during the developmental process. And I think it helps you understand the impairments and the problems that you're seeing if you understand where it came from. So you probably had this sometime in middle school or high school biology. But basically, at conception, the sperm and the egg combine. That's how the organism gets a full complement of chromosomes. That's occurring out here at the end of the ovary, and then that takes about 2 weeks, maybe not quite that long, for the embryo to move along. Let's see if I can get there we go. So to move along the fallopian tube, and then to finally come and implant into the lining of the uterus. So we have this ball of cells. So we have one cell, then of course it divides into 2, then each of those cells divides again, so that gives you 4. You can do the math. So we have this little rapidly dividing ball of cells that's moving along the fallopian tube and then finally implanting. And again, by 2 weeks after conception, that little ball of cells is implanted into the wall of the uterus, and then then at that point it's considered an embryo. So a lot of cell division, a lot of rapid cell division going on during this time. There can certainly be errors in cell division that occur, and as I'm sure you're probably aware, oftentimes miscarriages occur, often without people even knowing that they're pregnant, because of problems that are occurring during cell division at this time. And then, ultimately, the embryonic period is from about 3 weeks to 8 weeks. And you can see here the embryo. A couple of things I'll point out is you can certainly see this is the start of the brain, and we'll be looking at that a little bit. Spinal cord here, coming on down. You can certainly start to see some limb buds. You see the eye, of course, the gut area, and you see the lower extremity limbs. You see the start of the umbilical cord here, but we still see a big yolk sac here, which is telling us that the embryo is really not getting a lot of nutrients yet from the mother, because the placenta and the umbilical cord haven't really fully developed yet, and so they're still getting a lot of that nutrients from the yolk sac. So again, you see an embryo here and a yolk sac, and yet one more. We also see the amniotic sac. Right now there's a lot of room in there, so essentially the embryo is floating in there. It's very temperature controlled. Obviously it's sound controlled. It's dark, it's warm. So that's the environment in which the embryo is developing. So we really have 3 basic cell layers that are developing. Initially, as that zygote becomes a blastocyte and those cells are rapidly developing even in the pre-embryonic period, we're going to start with 2 layers of cells, which is an upper and a lower layer. The upper layer of cells are called the ectoderm, and the lower layer of cells the endoderm. And then finally in the middle here, we're going to get the mesoderm. And the only reason I mention these is because these are what are called the stem cells. I know you've all heard of those. Basically, those cells are all alike. Remember, they started from one cell, which divided. So those were exact replicas of each other. But at some point in the maturation process, those cells start differentiating and ultimately will be doing very different functions. So the upper layer of cells, again, the ectoderm, is going to become skin and hair, and the inner ear, and large parts of the nervous system. The endoderm, the lower or inner layers of cells, are going to become a lot of the internal organs. And then the mesoderm is going to become a lot of the types of structures that we deal with, like the axial skeleton, the skeletal muscles, connective tissue, etc. So again, during that period of differentiation and development, we could have errors occur that result in problems that will ultimately become developmental problems that we see in children. This is just a table. It just gives you the same thing. So I'm not going to ask you on an exam, list 3 structures that arise from the mesoderm. I just want you conceptually to understand generally the developmental process. I mentioned the placenta before, and this is going to form during the embryonic period. And the placenta is just a series of membranes through which oxygen, nutrients, antibodies, pretty much anything that the fetus needs is going to be kind of passing through to get into ultimately the umbilical artery and then to the fetus. And then of course the waste products, carbon dioxide and other metabolites, are going to pass back through the umbilical vein and then through the placenta back to the mother. Now recall though that there's not actually ever any mixing of the blood. So these substances certainly filter out and out of the blood and into the fetus, or into the embryo and ultimately into the fetus from the mother, but the blood itself doesn't mix. And we'll talk more about that with teratogens in just a minute. So we have here, again, just kind of more of a cutout view, a little bit more relative size. Here's a close-up of the embryo, and there's that yolk sac we talked about. Here's that amniotic sac as well, filled with amniotic fluid. And again, that's keeping constant temperature, constant pressure. There's really very little, because of buoyancy, very little effect of gravity on the embryo. And it just creates that very protected environment for the embryo to develop. So at this time, things are really small. The uterus is starting to develop and enlarge a little bit, but the embryo is taking up a pretty small area at this point. So despite the small nature of everything, and let me go back a couple slides here. I think this is a good one. This really shows you that a lot of the body systems are rapidly developing during this time. So again, we're only talking about up to 8 weeks, so, or to the end of the eighth week, and then that's going to be the pre-embryonic, and then up to 3 to 8 weeks is the embryonic period. So within 2 months, essentially, all the major organ systems have developed. So the liver is really developed and functioning by the 3rd week. There's skin, as you can see, by the 3rd week. The heart is beating definitely by the 5th week, maybe even by the 4th week. And again, you can see the brain and cranial nerves and the spinal cord are developing as well. So by the end of the 8th week, all the major organ systems are on board and are functioning. So that's pretty incredible. It's also a time of great risk for the embryo, because since everything is in the process of development, it's very much at risk for problems to occur. And this is where the idea of teratogens comes in. So teratogen literally means creating a monster, which is kind of a scary way to think of it. But it's anything, any agent, any item that could cause abnormal development to occur. And so I've listed a lot of examples for you. Some of those are viruses. So the cytomegalovirus, for one thing, can cause hearing loss. It can cause microcephaly, which I'll show you a picture of in a minute, cognitive delay, visual defects, and problems with dentition. Rubella, which is German measles, another virus, causes eye defects, can cause heart defects, hearing loss, cognitive delay, and just generally can cause developmental delays in growth and development. Toxoplasmosis is a parasite that can get passed through cat feces to humans, and this can cause prematurity, low birth weight. It can cause enlargement of the liver and spleen and other internal organs, and it can cause a lot of visual and cognitive delays as well. So again, you have to think about all these organ systems are developing, and so these viruses are going to go in and they will radically disrupt that development. Varicella, of course, is a herpes virus, and that can actually cause scarring of the skin in the embryo. Limb defects, muscle and limb defects, again a smaller head, even something as serious as blindness, seizures, and cognitive delay. You're probably all aware now, in the news is the Zika virus, and that's just kind of blasted on the scene in the last couple of weeks. And this virus, it hasn't been firmly supported yet, but they very, very strongly suspect that it is responsible for causing microcephaly. So this is a picture of microcephaly. Basically the head and the brain don't develop. Now you can see the face looks relatively normal size, but the cranium portion and the brain do not develop, and so this tends to cause very significant developmental delays. I'm sure you're all aware that there are many chemicals that would be very dangerous for exposure, for a pregnant woman to get exposed to. So certainly alcohol, we know that there are a number of significant effects of alcohol on the developing embryo and fetus, so growth retardation, cranial nervous system, a very small head. I'll show you some pictures when we talk about pediatric pathology of kids who have fetal alcohol syndrome, and you'll see a very characteristic changes to the development of the facial features, like a thin upper lip, kind of a small head, very small, close set ears, low set ears, things like that. Nicotine, of course, there's not any demonstrated safe level of nicotine while a woman is pregnant, so this can result in low birth weight and prematurity. Lithium, which is a medication people take for mental illness, can cause heart defects. Even something like a vitamin, which you'd think is healthy, but remember, especially fat-soluble vitamins can reach toxic levels, and so this can cause cognitive delays, again, deformities with facial and head development. People who need to take anti-seizure medication, that's very challenging because that can cause growth and cognitive delays. And probably not a big surprise to you, cocaine is not really good. It can cause a lot of problems as well, including developmental delays, but also infant drug withdrawal. So I know I've kind of gone on and on a little bit on this, but there are many, many chemicals, viruses, things that can interfere. But the reason it's so dangerous during up to the 3-week period is because that's a very, very busy time of growth and development for the embryo, and so the organ systems are most susceptible to disruption during the period that they're actually being developed. There are different categories, and I'm not going to, of course, hold you responsible for this, but some things we know are very, very dangerous, and those are absolutely contraindicated during pregnancy, and I think nicotine would be an example of this. There are some, we can go all the way to the other end where they don't show any risk at all, and kind of everything in between. So just to share that with you. So this is a kind of an interesting graph. If you look, it's pretty busy, but on the top it just shows you the age of the embryo, which is in weeks, and then it does go into the fetal period. And it's trying to show you little pictures of different systems and things like that, and also the pictures right along the top going horizontally, starting here and coming over, are showing you the size. So here's that little ball of cells that we talked about, the dividing cells, and then we're starting to see more of an embryonic shape here between the 3rd and the 8th week. These bars here, these colored bars, show you when the organ systems are most at risk. So that's the red. So that's pretty consistent. Even if you don't look at any of the words, you can see that a lot of the red is up before the 8th week, and then after the 8th week there's a lot more yellow, which still means that there's some risk, but that the risk is much less. So if we look here, we're talking about central nervous system. That is at risk certainly all the way through the embryonic period, and then even part way through the fetal period as well. Remember, we said the heart starts beating by about 5 weeks, so that would make sense that the heart is at risk, up till about 5 or 6 weeks. Upper limb development, lower limb development, you can see up to about 5 or 6 weeks. The eyes a little bit later, teeth and the palate a little bit later, external genitalia, and then ear development. So a lot of facial, head development types of things, as well as some of the internal organs. So this wraps up our talk about embryonic development, and after this lecture then you'll be going on to the fetal development video. Alright, you should have already watched the video on embryonic development. Now we'll have just a little quick overview of fetal development. So remember, the embryonic phase went up until 8 weeks, so our fetal development phase is going to start at 9 to 12 weeks, and well, at 9 weeks. And the picture here I have for you is 9 to 12 weeks. Now remember, the way we technically count weeks of development isn't quite the way people in lay terms talk about how many months pregnant someone is, but I think we can make that correlation. So at 9 weeks, as we mentioned before, the vulnerability to teratogens starts to diminish. Now it's not completely gone, of course, but it does start to diminish. And at 9 to 12 weeks, the fetus actually begins moving within the uterus. Now this is pretty exciting. So you're thinking at this very early time, when you think about movement patterns, the fetus is starting to practice those movement patterns. And really this whole period of prenatal development is just a big, long practice time. It's 7 months of practice, so that when the child is born, they are able to really do very, very many movement activities really well. Now, certainly gross motor activities are some of those, but another example would be swallowing and digesting amniotic fluid. Obviously, they don't need to do that for nutrition, but they are going to need to swallow and digest food as soon as they're born, so they really don't want to wait until then to practice. So they're going to be swallowing, they're going to be digesting that, they're producing urine. All those types of activities are already starting. Some other features continue to develop. External genitalia, facial features are developing and are present. When we go to 13 to the 16-week phase, I know this is not an exhaustive collection of activities that are occurring at this time, but two of the things that happen: hair starts to appear on the head, and the joints begin to form. So remember, before we said movement was occurring, so the muscles are moving and the body is moving, but there's not really joint formation yet or articulation. So that's kind of interesting, I think. But the joints are beginning to form. Now it's not until the period of 17 to 20 weeks that the fetus is large enough for the mother to actually start perceiving that movement. And an old term for that is called quickening. So we definitely know movement is continuing here, and this is when the mother would start to feel that. And for any of you who've been pregnant, I mean, it's a pretty exciting feeling to experience that. And if you haven't been pregnant, but you've been around pregnant women, you know that it's not until even much later that you can externally start feeling that movement by putting your hand on the woman's abdomen. So this movement is continuing to occur. Other things like nails are starting to grow and eyebrows become visible. 20 to 24 weeks is a pretty important milestone because respiratory-like movements begin. Now, I call them respiratory-like because, of course, the fetus is not breathing. It is taking in and I guess, inhaling and exhaling amniotic fluid because it's getting all its oxygen through the umbilical cord. But again, this is our notion of practice. The child is practicing the respiratory movements that are required. That allows those muscles to develop, to increase in strength, to improve in coordination and endurance. And so this is very important activity that's occurring even though the child doesn't need it yet. Just like they don't need to swallow yet. They do need to develop those muscles through practice and form the strength and endurance and coordination that they need in those muscles. Other things that we see is if we could look at the skin, it would look actually very wrinkly. Subcutaneous tissue hasn't really developed yet. The 25 to 28 week time is about the first time when we would expect the fetus to be able to survive outside the womb. Now they're still going to need a lot of medical support. One of the biggest issues is surfactant, which is the chemical, I guess, that allows the lungs to stay inflated, the alveoli to stay inflated, is just starting to be developed. And so they would need a lot of support for survival at this stage, and they still don't have very robust respiratory systems or temperature regulation systems. So again, thinking about the environment, they're still within the amniotic sac or within the womb, and surrounded by amniotic fluid. So they're still in a relatively weightless environment. They're still very cushioned. Their temperature is regulated. It's dark, it's warm, it's pretty much sound buffered. So they're in a very protected environment as they're growing here. And so to go at this early stage into a very bright, cold, noisy environment and where gravity has full effect would be a dramatic onslaught to the fetus, and so that would be a really challenging transition this early. The eyes do open and close at this point, and in boys the scrotum is developed and the testes are starting to descend from the abdominal area where they were developing down into the scrotum. As we move to 29 to 32 weeks, we know that some of the special senses are developing, such as taste, for example. The testes have descended, and the bones are fully developed. So we have, now remember, it's not bony tissue, it's mostly cartilaginous framework, and that will slowly ossify over a number of years up through, into early adulthood. But we do have all the bones present, all the joints present, so everything we need from a motor standpoint is certainly developed there. We don't have a picture of 33 to 36 weeks, but the nails reach the tip of the fingers and they have a firm grasp. And then at full term, which is 38 to 40 weeks, you see everything should be fully formed. The subcutaneous tissue has developed, and remember that's important not just so the baby looks pretty, but for cushioning and for temperature control as well. The other thing that you see is the fetus will tend to turn and assume a head down position. Now, obviously prior to this, the fetus has been moving and turning a lot, but we do see very close to birth assuming a head down position, so that's going to facilitate exit through the vaginal canal, and it'll facilitate birth. So this takes us through to the end of the fetal period, and again, I just want to emphasize the practicing that's going on and the environment in which it's occurring. So the child's been in definitely a weight-reduced environment, sound protected environment. It's been dark, it's been warm, and it's been pretty cramped as well. So the child's been in this environment practicing all the movement activities that it needs to do upon birth. All right, so when you go to the next video, we will talk about the postnatal period and talk about development up through the rest of the lifespan very, very quickly. Oh, I forgot we have this slide. Here's some things parents like to know. So it's a little encapsulation of just some other different things that occur. Some of these I mentioned, some of these I didn't, but it's always an interesting thing to kind of see what's going on. And if you've been pregnant or if you are planning to become pregnant, there are a lot of really just little fun books or resources that you can get that every day tell you a little bit of something about what's going on with fetal development. So that can be fascinating. All right, thank you.